Hello, my name is Dr. Arun Bhanot. I am the head of the Department of Spine Services at Manipal Hospital, Gurugram. Today, we will be talking about a very common spine problem that people come across in their day-to-day life. All of you must have heard of a term called as cervical spondylosis. So, cervical spondylosis is nowadays affecting almost every third or fourth person, and especially people who are into desk jobs, who are sitting in front of computers most of the time, or excessive use of mobile and other gadgets, that can also lead to higher chances of someone suffering from cervical spondylosis. Now, you might have heard of this term, but what exactly is cervical spondylosis? Cervical spondylosis is a combined term used to denote a situation where patients experience disabling neck pain. Sometimes the pain is there in the neck all the time. Sometimes that pain can go to the shoulder, or it also can go along the arm, either left or right, or sometimes both. So this depicts that there is some degeneration going on in our spine, due to which the intervertebral disc, which is a kind of a padding between the two adjacent vertebra, that gets damaged, that gets weakened, and because of the weakened structure, it can bulge out, leave its normal habitat, and occupy an area in our spinal canal which is otherwise supposed to be occupied by spinal cord or the nerves in the spine, which are supplying information to and fro from brain to the arms and the hands. Now, when the nerve gets pinched, it can either cause pain in the neck or in the shoulder or in the arm, as I already mentioned. Most of the times, this cervical spondylosis can be treated by lifestyle modification, by altering our day-to-day habits and reducing the actions which lead to higher chance of cervical spondylosis, as well as taking some medication and doing a good rehabilitation exercise program and correcting our posture in our day-to-day life. However, some of the patients who suffer from cervical spondylosis may have severe pinching of the nerve, leading to excruciating pain in the arm, or sometimes even if the pain is moderate but it does not go away and it keeps troubling the patient despite medication and rehabilitation. Such patients may need to consider a surgical treatment to solve their problem. Either the pain is excruciating or it is so disabling, though moderate, that it persists for a long period of time. In these patients, nowadays, we have a very advanced treatment available at our hospital, which is called as keyhole endoscopic spine surgery. Normally, keyhole endoscopic spine surgery was earlier practiced for lumbar spine in the lower back area, but here in patients who are suffering from cervical spondylosis, we can treat such patients with the keyhole surgery using high resolution camera and endoscope. In these patients, we just create a tiny 8mm hole in the neck, and through that the surgeons introduce that camera and that endoscope and look inside the patient's spine with a very magnified and a very clear pictures. Now, this offers the surgeon the ability to pinpoint and locate the problem in a very precise manner and without causing major trouble to the other normal structures like spinal cord and nerves. Therefore, the risk of nerves getting damaged is minimized, whereas the success rate of operation by use of high definition cameras and good quality images is it is increased significantly. Such patients can get the procedure done on one day and can also get discharged the very next day from the hospital. Such operations of the spine using the endoscope are proving a big boon for patients who may otherwise not get better with routine conservative treatment. Thank you.